If you're like many Americans, your goal for 2023 is to take steps toward better health. I know that's mine. This is especially important for seniors as the risk for health problems increases as we age. So if this is applicable to you or someone dear to you, like a parent or grandparent, there's important information you should know. As we age, the key is not only maintain good health, but also prevent problems along the way. And for seniors, a lot of the help needed is already covered by Medicare plans. The question is, do you know what's included in your original Medicare or Medicare Advantage plan? Dr. Rebecca Colon, Regional Vice President of Health Services in the Gulf South region for Humana Medicare, joins us to discuss the importance of being proactive with your health care and what services Medicare beneficiaries can access at no additional cost. Doctor, how are you?
I'm doing well, James. Thank you for having me on.
Well, thank you for joining us. So, doctor, let's talk about why proactive care is so important for long-term health.
Absolutely. Taking charge of your health is really important. And being proactive is really about getting in to see your doctor when you're well, instead of waiting until you're sick or you're in pain. And, Medicare, original Medicare and Medicare Advantage offers an annual wellness visit to its members where you can go in and address your health concerns and set up some screenings. So, we want to be screened for heart disease and types of cancers, as well as diabetes and glaucoma. And it's a perfect opportunity to identify chronic health issues, address chronic health issues, to make sure that we're doing everything we can to improve our long-term health.
Now, during the Medicare annual election period at the end of last year, we heard a lot about the choices that may be available to Medicare beneficiaries, like dental coverage, transportation and medical appointments, and even financial assistance that can be used for groceries and utilities. Understanding all of this can feel a bit daunting. How can we find out what's available to us?
Oh, great question. So there's so many options available to really tailor it to the individual's needs. Medicare, original Medicare and Medicare Advantage have additional benefits in place where you can, get dental care as well as hearing and vision. There's benefits for telehealth and transportation. There's even benefits for fitness. So a gym membership, for instance, those are things that may be available for you. So it's really important to, take advantage of those benefits. If you don't know about it and you want to learn, Medicare.gov is a perfect place to go learn. And if you're in a Medicare Advantage plan now, it's important to check your plan documents to make sure that you're taking advantage of that.
Yeah, and I go to the gym and I'm paying for it, so I need to look into that so I can get silver sneakers. Now, tell us about the passing of the Inflation Reduction Act and how that might affect our current plans.
Oh, absolutely happy to. The Inflation Reduction Act really provides an enhanced benefit for Medicare beneficiaries. What that means is it improves your pharmacy benefits. For instance, it covers more vaccines, including the shingles vaccine this year. It also provides low copays for insulin for diabetic patients. So it's a good thing to look into if you're in a prescription drug plan or just a Part D plan linked to your Medicare Advantage plan.
I've heard recently about the rise of in-value-based care. What does that really mean?
Oh, value-based care is absolutely wonderful because it really focuses on the patient. The goal in value-based care is a patient-centered approach where you're focused on the quality of the care that the patient's receiving instead of the quantity of services received. So it incentivizes the doctor who's involved in a Medicare value-based program to spend more time with patients, and it allows them to be able to do that and really address the health concerns and preventative care that's needed to really improve health and well-being overall.
With inflation continuing to make groceries and services more expensive, and the fact that many seniors live on fixed incomes, what would you tell Medicare beneficiaries about the financial impact of understanding their benefits?
As a doctor, I want to make sure that my patients have access to care, right? So what Medicare Advantage does is it helps with the financial burden. There maybe plans that in your area that have $0 premium. There are plans that have innovative benefits, such as a flexible spending account that you can use towards groceries or rent or even utilities, which tries to help with some of the financial burden that folks are experiencing. So you really need to know what you have available to you to make sure that you're maximizing that.
Speaking of knowing what you have, where can our viewers go to learn more, and where should they go?
I would absolutely recommend that your viewers, they go out to Medicare.gov to learn what's available for them. And if you're already enrolled in a Medicare Advantage plan, contact your plan or check your plan documents to make sure that you are maximizing those benefits and getting the care and the preventative screenings that you need, really to improve your long-term health and well-being.
We've been speaking with Dr. Rebecca Colon, Regional Vice President of Health Services in the Gulf South region for Humana Medicare. Doctor, thank you again for joining us on Morning Blend.
Oh, thank you so much. Have a great day.
You too.